Thank you. I mean, how do you follow Mark Noon, a motivational speaker, by talking about something as potentially dry as telemedicine? And so my job is to try to figure out, I'm a urologist, so you can see how you can picture that high noon poster. But also, this isn't Colorado, which is maybe a shame. But in any case, that's a different way of having high noon. So, having listened to what Mark had to say relative to execution and passion and all the other important words that he used, and to try to apply those to telemedicine and to do something translational and applicable to healthcare, I'm reminded about what the word execution is, and that is that it was a story about John McKay, who was the coach of USC Trojans, and then became the coach of the National Football League Tampa Bay Buccaneers. And for the first 2 seasons, his team lost every game. And at the end of the 32nd game, he had an interview with the newspapers, and they said, "Well, Coach, what do you think of your players' execution?" And he said, "I think it's a good idea." So there's different ways of having execution and interpreting execution, but certainly what Mark had to say can be applied, of course, to anything that we do, whether as it applies to passion or execution or urgency, although, once again, as a urologist, I think of urgency in a different way. But nonetheless, we need to see how we can apply those good words to the newest and fastest growing field of healthcare. It's the fastest growing sector in the fastest growing industry in the United States. So telemedicine is really the hottest thing out there as far as application to healthcare. So in our on-demand society, technology is shifting the paradigm such that we need to bring healthcare to the patient. We can no longer afford to bring the patient to healthcare. It's just too expensive, it's too cumbersome. We don't have the infrastructure, we don't have the people to do it. We just need to change the way we think about healthcare. And in my mind, there is no scenario under which, in the future of U.S. medicine, that we are going to be able to have healthcare, sustainable healthcare, without connected health or telemedicine. Connected health is the overarching theme of telemedicine, M-health, e-health, all the other healths. So it's now certainly just simply called connected health, but I interchange it with telemedicine. There was a movie, possibly a play as well, called Save the Tiger, back about 30 years ago. And in Save the Tiger, Jack Lemmon was this guy who had a company. Actually, it was a schmata business. It was a ready-to-wear business. He was manufacturing women's clothes in Los Angeles. And everything that could possibly happen to his business was happening in a negative way. Basically, he was circling the drain. He was going down the toilet. His family couldn't stand him. His kids didn't want to talk to him. His wife was leaving him. Like I said, his business was going down. He was thinking about torching his business in order to get the insurance money in order to survive. And he was constantly being questioned throughout the movie and as to what he wanted to do. And the final question at the end of the movie was, "What do you want? What do you want?" And his answer was, "One more season." That's all he wanted. He just felt as if he could just get through one more season, he would be able to survive, and then, of course, at the end of that season, he would want one more season. That has been the approach of many people in the health professions, and particularly doctors, who are just asking for one more season. Well, it's over. The seasons are not going to be the same in the future. The status quo is not only is it gone, it'll never come back. And that means that we have to use technology in order to advance the improvement of healthcare. And so There was Tom Goodwin as a person, an entrepreneur, and he made the comment, well, first of all, we're going to have healthcare without walls, which, of course, sorry, Donald, one more wall is not going to be built. But Uber is the largest taxi company but owns no vehicles. And Facebook is the world's largest, most popular media company, but has no content. Alibaba is the most valuable retailer, but has no inventory. And Airbnb is the largest accommodations provider, but has no real estate. And the largest provider of healthcare, it will have no hospital, will have no clinic. It will be telemedicine. Now, New York Presbyterian is the largest provider of outpatients in the country, and they do 1.6 million outpatient visits a year. Telemedicine is doing 9.6 million per year. Not an individual company, the largest of which is Teladoc at this time, and they do about 80 or 90,000 a month. So they're not the only provider, of course, and they're the largest. But the point is that in aggregate, there is more healthcare being delivered without a hospital or without a clinic than the provider that has the largest number that has walls. And so we think about all the different things of connected health. And it's a regulatory nightmare, but an efficiency dream. Now, regulatory agencies are nothing more than trade associations for the status quo. They usually build walls, Donald would love them, around different states, although he likes to talk about removing lines for his healthcare, for the future of healthcare. But the thing is that in order to control healthcare within a state, a regulatory agency wants to keep everybody out. And that is a very big issue on competitive issue, and it's also a very big problem as far as telemedicine. And so those walls are coming tumbling down. The regulatory agencies are being run over. Any agency, particularly one that comes to mind is Texas, they're on the wrong side of history. They can put their walls around the Alamo, and we all know what happened there. And so the point is that things are changing rapidly, and it's because technology is allowing everyone in this country to have access to care on a very short basis in time. Hospitals have robots in them. Yesterday you heard from Joe Peterson talking about the future of healthcare, and he used to run a company called Specialists on Call, which used a lot of robots. Robots are critical now in intensive care units, in ICUs, and in emergency rooms. There's business in primary care, direct to consumer, remote second opinions inside and outside the country. That is, people in Asia or South America or Europe, particularly Asia, are looking for the U.S. second opinions because they don't necessarily trust their first opinion. And so quickly with being able to upload their medical data and having either a conversation or just simply a consultation in print, they can get a second opinion from a national resource that we have. And that is kind of basically medical diplomacy. We're actually exporting intelligence rather than maybe exporting cigarettes or bombs, which are bad things to export. And then there's home health monitoring, house calls, which is back to the future fundamentally. There's a company called Pager. There's others called, I forgot. But anyway, there are several other companies that are out there that are actually delivering doctors to people's doors, which is something my dad did in the 50s when, as a general practitioner, he would actually make house calls that fell out of grace, and now it's coming back. But in our on-demand society, if you're hungry, you order a pizza. If you're sick, you order a doctor. There was a great commercial. I was in Shanghai recently, where I was looking around a retail area, and they had only restaurants. There were no stores, retail stores that we know of. And I asked my host, where are the retail stores? He said, well, really, everything is you just call and it's delivered. And as an example, there's a commercial in Shanghai that shows a guy who's on the toilet, and he's run out of toilet paper. And he picks up his cell phone, and by the time he needs the paper, it's delivered to his door. Now, it may be a little bit, hypothetical, perhaps, but nonetheless, it shows you that what people are thinking in other parts of the world, and how Amazon or other companies, Alibaba are taking over the way things are both marketed and delivered to us. And then the AMA and the Federation of State Medical Boards are finally coming to the conclusion that cross-state licensing is a good idea. I mean, it really doesn't matter whether you are living in California or in Iowa. If your body is the same, your diseases could be the same, everything's the same. The only difference is who's controlling that kind of medical care, and that's the regulatory agencies. So if it's different with the law, there are different laws in different states, but in healthcare, it's all the same. And so in order to improve the access to healthcare through telemedicine, by having cross-state lines, by having doctors being able to have licenses on various different states, it just makes it much more efficient and much more effective to be able to have a doctor in Iowa, for example, calling a patient in California without having a California license. Presently, you need a California license, but soon there'll be licenses that go across the entire country. The opportunities in telemedicine are enormous. Presently, there are 800,000 consultations done a month in this country. When I first started Teladoc, there were only a couple hundred that we were doing in the US. And now there's 800,000, which in the last 10 years, we've gone from rogue to mainstream, which is quite amazing. Except if you think about, there are 80 million interactions and consultations done in this country a year. And so 800,000 is, it's not even rounding off change. And so the point is that if there's so much opportunity, that leads to a lot of companies coming into this space. And as an example, it is estimated that there's at least 20 to 30 million consults could be done through telemedicine each month. Now, if we're doing 800,000 and there's 20 or 30 million potential, so you're at 5%. So that you can see that that the opportunities are enormous. And furthermore, there has been a tremendous reduction in the impediments to getting into telemedicine because the technology is now off the shelf. When Teladoc and MD Live and American Well were all starting to do their businesses 10 or 12 years ago, you had to create the technology in order for it to work. Now, Doctor on Demand, for example, started like 20 months ago, and they went from 0 to 50,000 consults because the technology was just easily available. And a new company, Wellvia, started about a year ago in Houston, and they're growing very rapidly. So if you look around the country, telemedicine companies are just jumping out of the, developing very rapidly because the opportunities are tremendous and the technology is easy. So all those important aspects of business make it such that telemedicine will continue to rise very rapidly in this country. So since as I mentioned, there's reduced barriers. Now, remote monitoring and with monitoring and cable box, right now what we're seeing is urgent care is being performed 800,000 times a month in this country. So if you have a urinary tract infection, a cough, a sneeze, an upper respiratory infection, bronchitis, or even a rash, all those things are being taken care of. But the real expensive things that are going on in this country are chronic care. And chronic care will be the newest and most explosive part of telemedicine. Now, one of the things that when you start an industry or a company is that you worry about the infrastructure because the infrastructure is so expensive. But the infrastructure in the United States for chronic care management, and particularly for telemedicine, is already developed. Everyone's house, or not everyone, but almost everyone's house has either dish or cable TV. And of course, we all have wireless. And so that means that the tens of billions of dollars that Verizon and AT&T and Time Warner, other companies have placed into our homes in order for us to enjoy a television show means that while I'm watching Homeland or Downton Abbey, they're watching me because it's a two-way street. All they need is a monitor, a $12.50 or $25 monitor, and they can monitor your blood pressure, your oxygen level, your sodium level, your pulse, almost blood pressure, almost anything about your body can be monitored while you're in your own home, which means that eventually what will happen is, in not too distant future, doctors will be calling you to say, I think you're getting sick, rather than 5 days later, you calling them and saying, I am sick. So that the change will reduce mortality, morbidity, and reduce costs. Now, the rural hospitals, there are 2,300 hospitals in the United States that are designated as rural. And there are 10% of physicians, but 25% of the US population live in designated areas that have reduced doctors in them. And so there's got to be a way of caring for these people because these people are not going to be transported to the hospitals of larger hospitals. They could be transported to smaller hospitals where there's not specialty care and they may not get as good a care as they well deserve. But through telemedicine, through connected health, through robots, being in the ER or being in ICU or being in the or doing telepsychiatry, these people will have access to quality care without having the doctor there. The doctor may be in another city, another state, but they'll be able to care for the people in a remote way. It's even more true for specialty care than primary care. So in hospital telemedicine, this is the robot I was referring to. This is one kind. It basically is an iPad on wheels. But the doctor is able to have an interaction with the doctor present. This is in the UCLA ICU. The doctor is standing against a wall and can have an interaction with a doctor in another part of the city, part of the state, part of the country. That thing can roll right up to the bedside and talk to the patient. The patient's data can be uploaded and including the images, so the doctor can make a diagnosis. This is particularly important in ICUs and also in emergency rooms for strokes. Because if a patient only has a few minutes after a stroke to determine whether or not he or she should get a certain medication. And by virtue of having a neurologist or a stroke specialist right there, that patient has a much, much better chance of reduced mortality or morbidity because they have someone that really understands what's going on and is able to help them. So in telepsychiatry, there's not enough psychiatrists or behavioral health specialists, and these people can be having interviews in the emergency room, in the hospital, using the robots. As an example, this is a complex slide a little bit, but really matters is the blue line. And it just shows you that telemedicine is growing at 56% per year. Now that investment is fantastic in any environment, certainly in the environment we live in now. And it just shows you that people are believing that telemedicine is going to be the future of the United States healthcare system. And here's just another way of looking at it. Rock Health is a startup, and they monitor the amount of money that is being invested in startups. And you can see once again over the years, 11 to 14, and it's even rising faster in 15. It shows you how much faster healthcare and telemedicine and connected health is being invested in. So the the infrastructure, as I already mentioned, Verizon Foundation and Apple and Google, they've invested billions and billions of dollars into the infrastructure, getting ready to monitor people's health in their home. And Walgreens and CVS and Rite Aid, they have kiosks within their pharmacies. I mean, it only makes sense if you aren't feeling well. And right now they have providers in the pharmaceutical companies. And oh, thank you very much. Thank you. They have providers in the pharmacies, but these providers are fixed costs. And so in order to make it much more reasonable as far as the cost structure for the pharmacy, they have variable costs, which is putting a kiosk in. Person walks in a kiosk, they get their blood pressure monitor, their height, their weight, whatever, vital signs, and then they are immediately linked into a doctor who's on the HD screen in another part of the city or country. And that helps the patient tremendously because they're able to get care immediately. And it helps the Walgreens, for example, because they don't have the fixed costs. Then the patient gets a prescription, perhaps, and the prescription is almost always going to be filled at the pharmacy where the patient is located. While they're waiting for the prescription, they're buying potato chips, which will cause their cholesterol to rise, so they need another visit, so they get another pill. But in any case, it's a great method for Walgreens or Rite Aid or CVS to be able to make money 6 different ways, and meanwhile the patient has the convenience of having a kiosk or a doctor visit in their neighborhood. It goes on in Kroger. They have what's called little clinics, but none of these really have the facility. None of these companies basically have the knowledge of the telemedicine, and so they usually are dependent upon telemedicine companies, whether it's MD Live, American Well, Teladoc, or others, that will be allowing the technology to be shared with the company and allow the patient to have the connected health that they need. Now, telemedicine, the problem with telemedicine as an industry is that as I said, the barriers are small, and so the competition is high, and that is unfortunately causing a race to the bottom, fundamentally, as far as competition. When you have many companies trying to see how little they can charge for a particular commodity, what happens is that they all end up losing money until somehow they figure out how they can get enough patients, and they can charge enough to each individual. They can charge to each individual that they'll be able to actually make money. Teladoc, for example, is the largest in the nation, first on the New York Stock Exchange, and it's losing $50 million a year. And somehow they're going to have to figure out how to do that, because you lose $50 million a year. After a while, your investors don't find that to be all that much fun. So the system has to change. There are multiple models which we can talk about at some point, but fundamentally there's a per employee per month model where the patient, employer, or insurance company, thank you, the patient's employer or insurance company pays a certain amount of money, let's say $1 a member a month, and then they have access 24/7, 365 to a doctor. And then if the patient then calls in for a consult, it costs the patient $40. Some have per employee per month, which includes the consult. Others just have consult only, which is what Doctor on Demand has. That is, they go direct to consumer. The thing is that when we talk about the future of healthcare, we're talking about, for the most part, telemedicine, which is telephonic. Some video as well. But 150 years ago, Alexander Graham Bell called Watson and said, "Watson, get in here," because he had just spilled some acid on his arm. That was the first house call. And if you think about it, telemedicine has really not changed that much in the last 150 years. That is, we still use a telephone. And so what's happening rapidly is the application of new technologies such as apps, so that patients are going to be able to interact with their doctor on their cell phone through an app rather than using a telephone, and through chat. Because as we all know, I mean, certainly you go to a restaurant and you see 4 people having a nice dinner, each chatting them to probably across the table. And they're not even talking. They're just chatting instead of having a conversation, because that's the way conversations are now done, particularly among certain age groups. So chat will be very important in the future of telemedicine. It's a cold method of interacting. The warmest is face-to-face. Next is video. Next is telephone. And by far the coldest is chat. But it's what people get used to. And that is something that needs to be taken into account as you go forward. The regulatory issues that have compounded or confounded the problems of telemedicine are really principally around prescriptions. Medical regulatory boards say that you need to have a face-to-face interaction in order to have a patient get a prescription. Well, the truth is, it's unnecessary. I mean, if a person has a cough, a sneeze, a upper respiratory infection, they don't need necessarily to have a doctor in their face, in their presence, and then give a prescription. In fact, truth is, they don't need a prescription at all. And if you really want to make a lot of money, invest in Z-Paks, because tens of thousands of Z-Paks are prescribed every month for viral infections, of which none of them ever help. But not all in all, patients don't call for a consultation because they want to have a conversation. They call because they want something. And what do they want? They want a prescription. And so the prescriptions, perhaps over-prescribing medication, but nonetheless, prescriptions is what happens after a telephonic consultation or a video consultation, about 85% of the time. The drivers and trends of healthcare that are impacting telemedicine, and for that matter, all of healthcare, have been one of the things that people have been concerned about as it applies to telemedicine. Telemedicine does not answer all the questions that are posed by the healthcare crisis in America. It doesn't answer everything. It just tries to improve the situation where there is reduced healthcare access. And so telemedicine is all about affordable quality access to care, so that what telemedicine does is that it substitutes an inexpensive venue, telemedicine, for an expensive venue, emergency room. So telemedicine costs $40, an emergency room costs $1,600. It doesn't take a rocket scientist to see how you're going to save money. But at the same time, you maintain quality. But there's another thing about telemedicine that everyone seems to know, that there is about 50,000 fewer doctors in the primary care in the future, very near future, than the country needs. In other words, the shortage of primary care doctors is critical. Well, that's true if you look at the old style of medicine, bringing patients to the facility. But if you can bring doctors to the patient, you can actually have some impact on the shortage. If you look at, in the next 3 years, 10,000 doctors are going to be leaving practice, primary care doctors, earlier than they otherwise would. Those 10,000 doctors each see 5,000 slots of time each year. So you have 10,000 doctors, 5,000 slots, 50 million opportunities to see patients. Most of these doctors who are stay-at-home moms or dads, they are retirees, they are disabled but still can care for people. If you talk to them, they will say, I would really love to continue to see patients, but I can't stand the hassles anymore. I don't want the insurance, I don't want the responsibility of the building, whatever it is. If you give them a smartphone, you immediately bring thousands of doctors online for tens of millions of slots, or certainly millions of slots, because you don't have to measure the number of doctors or bodies that are absent. You measure the opportunities patients have, which is access to doctor. So if you can fill those access times with a smartphone, you will suddenly be able to reduce the shortage. And for the first time, a technology is reducing the shortage of physicians. And that's important. Right now, it takes 12 years and $1 million to take a high school kid to make him or her a primary care doctor. There's no time. There's no money. But a smartphone can replace all that. Now, regardless of the politics, if you like Obamacare, you don't like Obamacare, it's here to stay anyway. I think the Republicans are tilting windmills, thinking that they're going to somehow remove Obamacare. But even if they did, they're going to have to replace it with something. But if you look at the mega trends, you see that in 2009, there were 15 to 16% people were were uninsured. And it rose as high as 18% in around middle of 2013. Along came Obamacare, now it's down to 12%. Now, people who are supportive of Obamacare will say, look, we reduced the number of the percentage by 7% or 6.5%, something like that, which is fantastic because people should have health insurance. At least that's the mantra. The other side of the coin is we turned the entire healthcare system upside down in order to insure only 6%. And that's the other side. That's the politics. I mean, if you reduce it by 6%, why don't you just keep healthcare as it was and give everybody Medicaid who didn't have medical insurance? We already had it in place. So it's the politics. But regardless of politics, there are megatrends, which also mean mega opportunities. So megatrends are aging in place, on-demand services, genomic medicine, obesity, addiction, immigration, physician workforce, concierge medicine, accountable care organizations. These are all megatrends that have nothing to do with politics. So that people are going to age whether there's Obamacare or not. And you can see that, that just on this chart, it's in the year 1900, there were only 3 million people who were over 65. Now soon there's going to be 72 million. I mean, that's not going to change. We have to adapt in order to deal with that through technology. Another thing is telemedicine at home. As I talked about earlier, as far as the infrastructure, you see a nurse with a nice couple. You take telemedicine, all of a sudden you just have the nice couple. You eliminate the nurse. That's probably a good idea, except she's awfully nice looking. But nonetheless, you end up with Granny's lap dance. With her doctor on her lap, being able to communicate with her about all the information that has been monitored through her home, through the box. As far as independence of doctors, this is very important. Now, it's not better, it's not worse, it's just different. I mean, it's a sea change what's happened with physicians. Physicians, as far as independence, there were 57% of physicians were independent in just year 2000 when George W. Bush was elected. And now it's 36% in 2013, it's 33% by now. Well, the point is that it has gone down from 57% to around 33% in 14 or 15 years. That is enormous change because there are different motivations for people who are independent. Some people will say it's better, some worse, it doesn't matter, it's different, we gotta account for it. And that can only be accounted for by using technology. And so when I speak to the young doctors, this is the access they have to private practice. There is no way. It's over for the most part. Megatrend is obesity. If you look at this country, you understand that there is enormous problems with obesity. In fact, there was a trend line that was plotted by an Emory physician who showed that if you look at obesity in this country and the cost of health care, they're parallel lines. It costs hundreds of billions of dollars to take care of the heart disease, the lung disease, the joints, the absolutely everything that collapses because people were built for maybe 150 pounds and they weigh 250. It just, what happens is that everything starts falling apart, and what then happens is that it falls upon the healthcare system to take care of it. So if you look at Mississippi, for example, in year 2030, almost 70% of people are going to be morbidly obese. Not just like pleasantly plump. I mean, this is like serious. And so you can see how this is going to be amazingly important. Furthermore, even the lightest color, Colorado, which is probably because they're all smoking, but they get munchies, and if they get munchies, half of them are going to be fat. Anyway, the point is that it is a very, very important megatrend, and you have to figure out how this is going to be an opportunity. Addiction is another tremendously expensive problem that this country has, and it has nothing to do with Obamacare. Although there was a fascinating article that maybe, perhaps many of you have seen about the cohort between 45 and 54-year-old white males who are dying faster than they ever imagined these people would die. And they are dying much, much faster than they're supposed to be dying because of addiction, alcoholism, suicide, automobile accidents, and other things. And also 1 out of every 3 white male between the age of 54 and 65, 45 and 59 has chronic pain. It's all about depression. And that is a huge problem in this country because these people saw that their fathers or their mothers were working in a factory. They had money to go on a vacation. They had money for maybe 2 cars. They had money for educating their kids. And these guys don't as a cohort. And they're very upset. Immigration, another mega trend. In 1970, 4.7% of the population was born outside the United States. In 2013, 13%. And so that also might be fueling some of the anger that is in that cohort that I mentioned, and also possibly fueling the Donald Trump phenomenon as well. One more mega trend, and that is the accountable care organizations are made up by the Affordable Care Act. The reason why that's important is that hospitals and hospital systems are now at risk. If you suddenly have skin in the game, you will make decisions based on that. So that instead of the hospitals saying, come on in for your physical, come on into the emergency room, they're saying, stay out. We don't want you. Because we get the same amount of money whether you're there or not, so therefore we make money if you're not there. And so they're using telemedicine to keep people out of the emergency room, out of the hospital, and that is a method by which they can sustain their ability to continue to care for patients. As they say in healthcare, no margin, no mission. And so if you don't have the ability to keep your system going, you are no longer going to be able to keep your doors open. Finally, the holy grail of telemedicine is direct to consumer. If you can figure out a way of getting people telemedicine through the internet, then you can be able to direct to consumer patients and get them health care without going through a process of employer or insurance. There's good parts of that and bad parts of it. Certainly overprescribing medication is one of the bad parts. But as Indiana Jones showed you what the Holy Grail chalice would look like, or Dan Brown would show you what his thought about the Holy Grail was, the point is that if you can get access to health care directly, you'll be able to make a major impact. So the next big thing, on demand, in demand, whether it's Wellvia, MD Live, American Well, Doctor on Demand, or many others, the future of healthcare is technology, and the technology that will be used is connected health. Thank you.